The thing I like best about my job is working with kids. That's what drew me to pediatric care in the first place. I thought I was going to be a pediatrician, and I ended up loving surgery. So I went into a field where I can do the surgery, but in a way where the kids are in good condition and I can have good interactions with them and build a real relationship with the kids and with their families. Hi, I am Dr. Jonathan Ida. I am a pediatric ear, nose, and throat surgeon at Lurie Children's Hospital in Chicago. One of the fascinating things about pediatric otolaryngology is that there's a lot of interplay in the various areas in the ears, face, nose, and throat. For example, things that affect the nose can affect the ears, but can also affect the lungs and the airways. Things that affect the stomach can affect the voice box and can affect the way that we perceive things going on in our nose. As a pediatric otolaryngologist, I do a lot of general pediatric otolaryngology, which is sort of like the ear tubes and the tonsillectomies, that kind of thing. I also specialize in complex airway evaluation and treatment, focusing on complex airway reconstruction as well as swallowing problems and breathing problems. We work very closely with other pediatric specialists such as pulmonary medicine, the lung doctors, as well as GI, the stomach doctors, because those things can certainly affect the airway. We also work very closely with our speech therapists in all of these clinics because the swallowing and voice and speech parts are so critical to the outcomes that we're looking for. We're not just trying to fix the airway, we're trying to fix the airway with the best voice, swallowing, and speech outcomes that we can possibly get. Surgery is definitely scary. It's normal for parents and children to be nervous about it. It's completely normal. We have a lot of ways here at Lurie Children's that we help alleviate that. First of all, the expertise. We've done this a lot. We are the regional children's hospital. There really is no other dedicated freestanding children's hospital in the Chicagoland area. In addition to that, we go above and beyond. We have child life therapists. We have multiple protocols that are really focused on making sure that the children and the families are comfortable with everything that's going on as we go through the process. Seeing what we can do for families and children is really what gives me hope. The ability for us to help families and children be the best that they can be so they can focus on everything else in life instead of their health care gives me hope that they can go and do great things in this world. We get hung up on thinking that this is like people's lives. This isn't people's lives. This is like a little snippet, and we're here just to make the rest of it better. And that's really what drives us.